Good afternoon and thank you. I'm Mike Farnworth, BC's Solicitor General and Minister of Public Safety. Today I'm joining you from the traditional territory of the Lekwungen-speaking people and the Songhees and Esquimalt nations. I'm also joined by Minister Adrian, the Minister of Health, as well as Dr. Sarah Henderson from the BC Centre for Disease Control. As we're all aware, a heat warning is in effect due to higher than expected temperatures, and we're doing a number of things to help British Columbians get through this heat wave safely. Over the past week, Emergency Management BC has been working with local communities and First Nations to ensure they have the support that they need. This includes reimbursements for cooling centres that have targeted support for vulnerable British Columbians, transportation to and from cooling centres in communities where no scheduled public or reasonable transportation exists, staff wages and overtime to compensate for the opening of civic facilities that would otherwise not be open, and water for distribution within those facilities. Also, in the interest of public safety and in order to reach a broader range of British Columbians, government is working with TV and radio stations to provide critical info during this second heat wave. In addition, we will continue posting social media updates to get out much needed information on how to find local supports. The province's Emergency Info BC website, which can be found at emergencyinfobc.ca, is a one-stop shop for information on wildfire evacuee supports, as well as information on heat wave supports, how to prepare, and info on heat-related illnesses and cooling centre locations. People who are evacuated from their homes due to the wildfires are particularly vulnerable during this time, and local governments are being encouraged to let evacuees know about cooling centre locations in their area. So people should plan ahead. Find out how you can spend time in a cool or air-conditioned place. While heat can harm anyone, older adults and children younger than 5 years old are particularly vulnerable to the effects of a heat wave. So I encourage all British Columbians to check with one another, especially on those people you know are living alone. Be sure to use the supports available and to take extra care of any vulnerable people and their family, friends, and pets this weekend. I also want to thank local governments and healthcare workers for mobilizing to help British Columbians stay cool and safe through this heat wave. The heat wave is a stark reminder of the impacts of climate change and the need to prepare for hotter weather and more frequent heat events as people and as government and as a health system. Thank you.
Mr. Farnworth, and as all of you know, Environment Canada heat warnings are in effect for most of the province. The very high temperatures are expected to continue for the next 48 hours at least, and that this is happening, of course, at a time when many people in the province are experiencing very poor air quality from wildfires. That will affect an increasing number of people in the province this weekend. Extreme heat is dangerous. It takes a toll on people's health. It's especially risky for people who are vulnerable, like seniors and people dealing with chronic health conditions. When temperatures go up, it's time for all of us to step up to help keep people safe and to help keep people cool, to help protect ourselves and our loved ones. The province is mobilized to help people during this heat alert across the healthcare system and across other government ministries, as Minister Farnworth has said. Working together with our health authorities and local government partners, we're ready to help people and communities beat the heat. And this work is already underway. All of our health authorities have all their systems on emergency footing to help anyone who might experience heat or smoke-related challenges. In acute care, emergency rooms staff are being redeployed to emergency rooms to meet demand. And steps are in place to keep people in hospitals cool and safe. In long-term care, residents and their families will see staff taking proactive steps to keep everyone hydrated and cool. In home care, caregivers will be checking in with you, with everyone, to make sure that they're okay, and if they need help, they'll get the help that they need. In all of these sectors of the healthcare people, the people that we connect with regularly, we are mobilized, as we have been in the past, to assist. I want to add, with respect to emergency health services, that if you or a loved one experiences heat-related illness and you need help, please call 911. The BC Ambulance Service is ready to serve you. The new Chief Ambulance Officer is taking steps to ensure people who call for help get help and get help quickly, working with paramedics and dispatchers in every case. Provincial and emergency operations centres are now in operations in BC EHS. More clinicians are working this weekend to help the dispatchers responding to your calls to make sure the response you get is the best response. Managers have stepped up to work at hospital ERs to make sure people who need immediate medical attention get out of ambulances and into care as quickly as possible. The Chief Ambulance Officer is also taking steps to make sure paramedics are well supported. They will take care of people who take care of us with water, Gatorade, and permission to wear clothing that's made for summer, not a BC winter. In addition, the province is getting a big assist from the ambulance paramedics of BC, CUPE Local 873. They have been instrumental to the province's work to renew the ambulance service, and they are going above and beyond this week to make sure that when people call for help, they get a response and get a response quickly. Thanks to them, we are bolstering BC's emergency response capabilities this weekend. This includes the activation of on-call rural shifts to full-time for the weekend periods, pre-scheduling overtime with a pick-a-partner, pick-a-time approach, flexibility with pairing and using EMR staff in the Lower Mainland from other areas by teaming them up with other paramedics, transfer calls for 911, low acuity, staffed with EMRs, alternate transportation being made available, and redeploying community paramedics in some parts of the province